Hello, my name is Spence. This is my audience. I'm here today to inform you on the proper methods for drawing blood and strategies needed to do so. We are all blessed in a day. We live in 2015 where we have literally thousands of tests that we can use to test for different blood maladies and different issues that people may have to help physicians ascertain what might be wrong with us. From the day that we're born to the day that we die, and many days in between, blood needs to be drawn. So it's important to have a clinician who can do so. So let's talk about the day that we're born. When we're a baby, in the United States of America, a PKU is ordered on every baby. A PKU is a phenylketonuria test that checks to see if the baby's body can metabolize the enzyme phenylketonuria, which will make sure that the baby does not have brain damage or seizures. In order to do this test on a baby, you will have an uncooperative patient. So the most important thing at first is to have a good grip on the baby's foot using your non-dominant hand. The baby's going to punt and kick and scream, so you got to make sure that that baby's not going to kick the lancet or the tube or the pipette that you've got obtaining the specimen. So with a good grip on that baby's foot, you're going to apply a warm compress. Applying a warm compress is going to increase the circulation of blood into the capillary bed that you're drawing from. The baby was in utero for 9 months and does not have an optimal circulatory system. So it's important to put the warm compress there to initiate good solid blood flow. After the warm compress is on for 2 to 3 minutes, you'll remove it and take your lancet and you're going to hold it firmly to the skin. Holding that lancet properly is going to be crucial not to have a shallow stick. Having a shallow stick will not give you enough blood drops to obtain the specimen. The baby will kick and the baby will scream, but it's not going to matter because you're going to have a good grip with the non-dominant hand. Now for the adults. Adults can have multiple issues to make it difficult on us. Although they are cooperative, you can have children's veins, you can have elderly veins, you can have dehydrated people, you can have obese people, you can have veins that are sclerosed from multiple uses of IVs and antibiotics. So it's very important that you know what you're sticking in order to obtain blood from a vein. The ideal spot is what's called the antecubital fossa, or the AC. The AC has the 3 most prominent veins in the arm and is an ideal spot for drawing large quantities of blood if it's ordered. But you can't just stick any vein. You've got to know what you're sticking. You have to know what you're doing. You have to palpate this vein to know exactly where you're gonna go, and you need to make sure that you feel it. You can't just stick a vein that you see because you don't know exactly what the condition of that vein is. So you feel it, you palpate it, and you know exactly what you're getting. After you've palpated a solid vein and you feel comfortable with its sponginess, it's going to be very important to anchor that vein down, especially in the elderly or in people who are dehydrated. You have to have an anchor with your thumb to make sure that vein's not going to move or roll on you. Invariably, it will happen. But once it does, and you have good thumb placement, you can reintroduce the needle to get the specimen. In this day and age, you will always have blood tests ordered, from doctor's appointments to your children to accidents to disease. Making sure that you have somebody who can draw that blood is going to be of the utmost importance to be able to have the specimen to be able to figure out what's going on. Thank you.